Everyone, today we are going to discuss about how to write nursing care plan or the steps of nursing process. We will go to the video. Before going to start, we will understand the meaning of nursing care plan first. What is nursing care plan? Nursing care plan is a documentation to know what is the problem of patient, and it provides all information about communication among nurses, their patients to achieve healthcare outcomes. So it's a communication between the nurse and patient, and we are documenting it. So we can say it is a documentation to know what is the problem of the patient. What is the content of nursing care plan? So a nursing care plan includes some specific steps, or a nursing process includes some specific steps such as assessment, nursing diagnosis, the goal of treatment, planning, rational, implementation and evaluation. These are all the steps we have to follow while writing a nursing care plan. First we will see what is assessment. Assessment means simple meaning I will tell. Under assessment, we are assessing or understanding the condition, behavior, and health status of the patient. So, under assessment, what we are doing means we are just assessing or we are understanding the condition of the patient or behavior of the patient or health status of the patient. Under this assessment, we are writing two headings, that is two subjective heading, that is subjective data and objective data. What is subjective data means what the patient says, what the patient is telling about his condition or her condition, that is subjective data. And what is objective data means what the nurse is observing or what is nurse's observation, that is objective data. So two things we have to write under assessment heading. First thing is subjective data, second thing is objective data. Subjective data means what the patient says and objective data means what the nurse's observation. I am giving an example here. While reading this example, you will understand what is subjective data and what is objective data very easily. What is subjective data? The patient says that I am not able to interact with others. Just an example it. I am not able to interact with others. So what the patient is saying, that you have to write under subjective data. Second thing is objective data. Objective data means what you are observing. As a nurse, what you are observing. That is objective data. So, you have to write on observation, the patient is showing anxiety and verbalization difficult. So, that is the objective data. So, again I am repeating. Subjective data means what the patient says about his condition or her condition. What is objective data means what the nurses is observing after discussion with the patient or after observing the patient. So that's the first column of your nursing process or nursing care plan. Now we will go to the second column, that is nursing diagnosis. So in second column you have to write the heading nursing diagnosis. What is nursing diagnosis means according to North American Nursing Diagnosis Organization International, that is NANDA. Nursing diagnosis means a list of health problems that the patient is facing. So nursing diagnosis means a list of health problems, a group of health problems what the patient is facing. That is known as nursing diagnosis. And this information is used to find out the actual and needed care to the patient. So this information is used to find out the needed care or actual care of the patient. And there is a format we have to follow while writing nursing diagnosis, and that format we are following from North American Nursing Diagnosis Organization International, that is NANDA diagnosis format or organization format. I will give you an example for nursing diagnosis here, how to write a nursing diagnosis. Impaired social interaction related to inability to perceive the consequences of their action as evidenced by verbalization disturbance. So while writing nursing diagnosis, you have to specify the problem, what is the reason of that problem and what is the observation and what made you to understand this problem. So here impaired social interaction, that's a problem related to inability to perceive the consequences of their action as evidenced by verbalization disturbances. So in this format you have to write the nursing diagnosis. So related to that word and as evidenced by, that two words are important while writing nursing diagnosis. So problem you have to write, reason you have to write, and what basis you are telling that impaired social interaction. The 3 points you have to specify properly while writing nursing diagnosis. So that is the second column of nursing care plan, and we are going to the next column, that is goal. What is the goal of your nursing care plan. So what is goal? Goal is the desired outcome or change in the patient behavior or health status. That is goal. And this goal will serve as criteria for evaluation and help the nurse to determine which problem have been resolved. That is the meaning of goal. So there are two type of goal we have, might be a short-term goal or a long-term goal. From the word itself, you will understand the meaning of short-term goal and long-term goal. Short-term goal means for short period of time. So that can be completed immediately, usually within days or hours. That is short-term goal. Long-term goal means that can be completed over a long period, usually over weeks or months. So either it is short-term goal or long-term goal. But we need a goal and we have to write a specific goal in the nursing care plan. So goal is the desired outcome or change in the patient's behavior or health status. One example I will tell based on the condition what we have discussed in the nursing diagnosis. The patient will achieve normal interaction pattern with others. So here we have seen the problem impaired social interaction related to inability to perceive the consequences of their action as evidenced by verbalization disturbance. So this is the problem. So what is the desired outcome? The patient will achieve normal interaction pattern with others. That is our desired outcome. So to get that desired outcome, we have to plan the things or we have to make a checklist. So that is the next column of your nursing care plan, that is planning. So I think this is the action section of nursing care plan. So in planning column only we are doing all the action. So based on the diagnosis and goal, here the nurses will make planning like a checklist to implement. So we are making lot of plan here like a checklist to implement. And it will be according to the need of the patient. That point is very, very important. It has to be based on the need of the patient and needed to record or document carefully to determine the progress of the patient condition. So we have to do it based on the need of the patient. At the same time, we have to record it or we have to document it carefully to determine the progress of the patient condition. So planning is the next section of your nursing care plan. I will give you an example for this particular condition, that is impaired or particular situation impaired social interaction. In that condition or in that situation, what are all the planning you have to do means collect history, do mental status examination, provide psychological support, involve the patient in recreational activity, provide medication as per the doctor's order. Like that you have to plan. You can plan based on the condition, based on the need of the patient, and after planning it you have to record and document the things carefully to determine the progress of the patient condition. So I am again telling this is the action section of your nursing care plan. So you are planning everything. You are doing all the action in the planning section of your nursing process or nursing care plan. From the planning, we are going to the next stage of nursing care plan, that is rational. That is the next column. What is the meaning of rational? Rational means scientific explanation. Rational are the underlying reasons for which the nursing intervention was chosen this particular nursing care plan. So for what purpose you did the particular plan, that we are explaining in the rational. If you see this example, you will get more understanding. In planning, if I am writing, collect the patient history or patient's illness history. In rational, you have to write for what purpose you are collecting the history, to know the general health status of the patient. In the planning, if I am writing do mental status examination. In the rational, I have to write to understand the mental state and general appearance of the patient. So I am giving a scientific explanation or explanation for my planning in the rational column. So that we have to write under rational column. So rational means that is an explanation column. For what purpose you have planned this particular plan, that you have to write in the rational column. So if you are planning collect the patient history, in rational column you have to write to know the general health status. So that is rational column of your nursing care plan. Scientific explanation for what purpose you are planning the particular checklist or particular plan. After rational, we are going to implement the thing. That is the next column of your nursing care plan, implementation. In this section of our nursing care plan, we are implementing the plan. That means history collection, that's a plan. Mental status examination, that's a plan. So what we are doing in this section means, in the section of our nursing care plan, we are implementing the plan what we have formulated in the planning section to improve the condition of the patient. So again telling the example. So if you see this example, you will understand easily. Collected illness history of the patient. So you have planned in the planning column, collect history, collect illness history. In the rational column, you have written to understand the general condition of the patient. in the plan implementation column, you are writing collected illness history. So you are implemented it. So you are writing collected illness history. Then in the planning column, you wrote what do mental status examination. So in the implementation column, you have to write completed or done mental status examination. So in implementation column, we are implementing the plan, what we have formulated in the planning section to improve the condition of the patient. After that, we are going to the last section of the nursing care plan, that is evaluation. Here, we are evaluating the progress of the patient condition, and the evaluation is used to determine if the nursing orders need to change or are complete. So, evaluation is very important to understand the progress of your plan, and is there any need to do the changes. After doing the evaluation only, we can understand that. So in this example, you can see how to write the evaluation. The patient maintained normal interaction with others to some extent. So after implementing the plan, you are coming to an evaluation that the patient maintained normal interaction with others to some extent. So this is the format you have to follow while writing nursing care plan. So this is the steps we have to follow in a nursing process. So assessment, diagnosis, planning, rational, implementation, and at last evaluation. Under assessment, you have to write both subjective data and objective data. Now I will tell you the general format of writing nursing care plan in the practical section. You have to start your nursing care plan with history collection. So some general biodata or identical features of the patient that you have to write first. So first heading is history collection. Under history collection, again the subheading patient biodata. Under patient biodata, you have to write name, age, sex, religion, education and occupation, MRD number, that is medical record number. So this kind of identical data of the patient you have to write under history collection. And marital status of the patient, address of the patient, informant, that means who is giving information about the patient. In the case of mental health condition, sometimes the patient is not in a sound stage to give information. In that case, someone who is taking care of the patient is giving information, and that patient's name or that particular patient's relation you have to write in informant column. And at last you have to write the present diagnosis like depression, mania, ADHD, OCD, whatever it is. So this is the first section of your nursing care plan. Then second section is history of present illness. That means you have to write the history of illness. Under that, main thing, present chief complaints. You have to list out all the chief complaints of the patient based on your condition. Then present medical history. Present medical history, like any medical condition the patient is having and taking treatment, means that you have to mention specifically under present medical history. And there is no present medical history means you can write no significant history of present medical history. Then present surgical history, same way like medical history only. If there is any surgical history or undergone any kind of operation, means that you can write under present surgical history. And if there is no present surgical history, means you can write no significant history of present surgical history. Next is past medical history and past surgical history. Same thing again repeating. If there is any past medical history and past surgical history, means that you have to specifically mention under this past medical and surgical history. And if there is no past medical and surgical history, means you can write no significant history of past medical history and no significant history of past surgical history. Then present psychiatric history, that you have to mention detailedly what is the present condition of the patient, whether the patient is maintaining social interaction, whether the patient is having anxiety, whether the patient is in depression stage, that you have to specifically mention under present psychiatric history. Then past psychiatric history. Same way only, if the patient undergone any kind of treatment or psychiatric treatment, that you have to specifically mention under past psychiatric history. And if there is no psychiatric history, means you can write no significant history of past psychiatric history. Then educational history and occupational history. In educational and occupational history, you have to write the educational status and occupational status. So all this history you have to mention properly. Chief complaints, present medical history, present surgical history, past medical history, past surgical history, present psychiatric history, past psychiatric history, educational history, occupational history. So this kind of histories are very important in the case of mental health condition, because these histories will give a chance to understand the actual problem of the patient. Next, childhood history. Childhood history is very important, because childhood problems are very important to understand the condition of the patient. Sometimes these childhood problems, traumas and events are acting as a triggering point or triggering cases or triggering reason for the present mental health problem. So you have to write detailedly the childhood history. Then marital history, that means married or not unmarried, that you have to mention. Then legal history, that means any imprisonment, any divorce or any punishment regarding that you have to write under legal history. Then habit of the patient. Habit of the patient means how they are interacting, what kind of sleeping habit, what kind of hobbies, and that kind of things you have to write under habits. Then next thing is interpersonal history, what kind of relationship they are maintaining or the patient is maintaining with others, that you have to write under interpersonal history. And last one is psychomotor history. Psychomotor history means what is the emotional stage of the patient, whether the patient is having control over their mood or any kind of overwhelming the patient is showing, and that kind of information you have to write under psychomotor history. So these history is also very important, like childhood history, marital history, legal history, habits, interpersonal history, and psychomotor history. So this many headings you have to write under history of present illness. That's the first section of your care plan. So first thing is history collection. Under that subheading, what is that? Patient biodata. Under that, all the identical features of the patient. After that, next heading, history of present illness. Under that, all the histories from chief complaints, medical, surgical history, psychiatric history, childhood, marital, legal history, interpersonal, and psychomotor history. This many headings you have to write in the second section of your care plan. Next is family history. In family history, you have to make the column like this. You can see in this slide. So you have to write name of the family members, age of the family members, sex of the family members, and relationship of the family members towards the patient and health status of the patient members. Writing family history and family tree is very important in nursing care plan, especially in the psychiatric nursing care plan, because family problem, hereditary factors are playing a major role in developing different kind of psychiatric conditions. So family history you have to write properly and detailedly in nursing care plan, nursing case studies, and case presentation. Next is family tree. You have to draw the family tree properly and you have to mention who is deceased, who is dead, who is female, who is male, and you have to specifically and neatly you have to draw the family tree. That is the third section. Then we are going to the fourth section, that is MSE, that means mental status examination. While writing mental status examination, you have to write detailedly with the conclusion, and conclusion is very important while writing mental status examination. And regarding mental status examination, how to write mental status examination, all these things already I have uploaded the video. In the previous videos you can see how to write mental status examination. You have to watch that video before writing mental status examination to get proper understanding about how to write mental status examination. Again, I am repeating, while writing mental status examination, you don't forget to write the conclusion. Conclusion is very important while writing mental status examination to understand the idea, to get an idea about the general mental state of the patient. After mental status examination, we are going to the last section of your nursing care plan. Very important step and important section of your nursing care plan format. That means list out the nursing diagnosis based on the priority and write it. List out the nursing diagnosis based on your condition. First, you understand the condition properly, understand the meaning of the condition, and understand and read the chief complaints properly. And based on the chief complaints, you have to formulate the nursing diagnosis, that too in priority base. In priority base, you have to formulate the nursing diagnosis. After that, you can go to the last section of your nursing diagnosis, that is developing nursing care plan. While developing nursing care plan, I have told you already the steps of nursing care plan, that is assessment, nursing diagnosis, planning, rational, implementation, and evaluation. So in this slide you can see how to make the column. First column is assessment, second column is diagnosis, third column is planning, fourth column is rational, fifth column is implementation, and sixth column is evaluation. So this many columns you have to make, 1, 2, 3, 4, 5, 6 columns. Under assessment, again 2 headings are coming, subjective data and objective data. What is subjective data means what the patient is saying. Objective data means what is your observation. Then under nursing diagnosis, you have to write the goal or desired outcome. What is the desired outcome of this particular nursing diagnosis, that you have to write. After that, you have to plan the things, that also based on the priority of the patient, based on the need of the patient. After that, you have to write the rationale. What is the explanation of each planning? For what purpose you have planned it? That you have to write in the rationale column. Then you can go to the implementation column. There you have to write in the past tense what you have implemented. Then at last you have to write the evaluation. This is the format of nursing care plan. So in this way you have to write your nursing care plan, and at last you can conclude the things with a conclusion. Now I will give a example nursing care plan for depression. In the case of depression, priority based nursing diagnosis is impaired social interaction related to inability to perceive the consequences of their action as evidenced by verbalization disturbance. So this is the nursing diagnosis. In this nursing diagnosis, how to formulate the nursing care plan, that you can see in the screen. First, you have to write the assessment. Again, I'm telling, under assessment, you have two headings, subjective data and objective data. So, under subjective data, what the patient is saying. So, the patient is says that I could not talk to others in comfortable way and feeling tension while talking. So, what is objective data? On observation, found that the patient is having anxiety, fear and verbalization difficulties. Then you have to write the nursing diagnosis. The next column is goal. What is the goal? The patient will maintain normal social interaction. That is the next column. Then you have to plan the thing based on the condition of the patient. Then you have to write the rationale. You have to write the implementation, and at last you have to write the evaluation. So this is the format you have to follow while writing nursing care plan in the practical section. Hope you understand. Thank you.